So I have a lot of people have talked about the whys, so what the merits of 3D printing. I have the dry topic of how to implement the 3D topic. So I wish it was after the coffee. You guys would stay awake. So I'm gonna see if we can present how to turn the 3D printing from dream to reality. I have no financial disclosures. Well, this is some of the things I'll talk about in the brief time that I have. So first, I'll tell you a little bit about who we are. Geisinger Health System is a medium-sized integrated healthcare delivery system. We have we serve 45 counties in Pennsylvania. It's one of the states in the United States. And we have about 30,000 employees, 12 hospitals, campuses, and 2 research centers. Just to put it into perspective, this is the area that we cover. It's about a little bit smaller than the size of Ireland. So 3D Lab did not start out as a 3D printing lab. We started as a 3D imaging lab. Approximately 5 years ago, we thought that it would free our modality technologists as well as physicians from the 3D image processing, and better and consistent processing would be done, and therefore increasing efficiency. Now, one of our cardiologists came to us and said, "You guys are doing such a good job doing 3D imaging. Can you start a 3D printing program?" And we were obviously very interested. There are many use cases that you can use that have been well presented throughout the day today. And that's where our journey to realize our dream began. The dream is one thing. Selling that dream to get the funding is another thing. So selling the dream to radiology leadership was a task. It took us a little bit of time. At that time, I was not in leadership position. Otherwise, it would have been already sold. We started with a modest prosumer printer in the first phase. As a previous speaker spoke, you start small and build up. And once we decided that, one of our team leaders then took the ball and ran with it. We addressed the issues as they arose, but if I had to do it all over again, I would plan better. So in the phase 1, we started with the prosumer printer. The disadvantage of starting with a prosumer printer is that there are no trainings. You have to train yourself. There is no training that comes along with it. So we had to learn how to use it, how to work with the materials, how to make sure that the print doesn't come off the plate, and therefore learn how to troubleshoot. So one of the first things we did is actually printed a publicly available GoPro mount so we can actually monitor what we're doing and troubleshoot when we needed to. And subsequently started printing for our customers. Cardiology was the first customer that we had because that's where the request came from. And subsequently, they use that to look at complex cases and use simulation on those cases. So they printed out the heart and the aortic arch. Then they would put that under fluoroscopy and use different instruments to figure out what's going to work on the patient, and therefore reducing the time of surgery. This is the modest printer that we started with. It's small but effective. Despite the prosumer model, these were some of the models that we were able to produce with it. We have an aortic aneurysm, a dissected aorta, mandible, as well as some of the things we were printing, skulls and so on. So while we were working with phase 1, we started planning for phase 2. Phase 2 was a much bigger job because we wanted to make sure that the next step is a little bigger than the small print that we had. So we applied for several grants, and we have received 2 internal grants with a total of about $300,000 US. Subsequently, we acquired, we had been talking to vendors. One of them was obviously Materialise, and we acquired their suite, and it has been an outstanding partnership with them. Evaluated multiple printers, and acquired 2 state-of-the-art printers. So we're not at, we don't have the multiple printers a lot of the other speakers have had, but it's the beginning. We already installed one, and The second larger printer is being installed in a couple of weeks. Proper staffing on hardware and software is the other thing that we were able to do. And so far, we've been up for about a year and a half. We've printed nearly 100 clinical prints. So here's an example of a print where there are complex facial fractures, and our surgeons use this to plan the surgical approach. Here's a fractured mandible, single print having multiple materials in it. And you can see that there's a fracture here, and that fracture, the surgeon then used the model to customize the hardware before surgery. Here's a small heart with repaired transposition of great vessels. This was used to train our sonographers so that they know after the repair what kind of anatomy to expect, and they can get better images for follow-ups. Here's a brain printer for our neurosurgeons, and it has a tumor within it. Right here, it has the blue is the white matter tracts, and some of the functional areas on functional MRI, so that the surgeon can then actually understand what the relationship with the tumor with the other critical areas is and plan the surgery better. So this was our experience. What did we learn from it? I'll tell you a little bit more about it. From that, once you have the dream, I think the first thing to do would be to define who your stakeholders are and form a team. We started alone, and with a little bit of help from cardiology. If I had to do it all over again, I'll probably involve the other stakeholders, neurosurgery, maxillofacial surgeons, cardiology, and so on much earlier. Develop a shared vision and have specific near-term goals. Discuss who and what you will support first so that you know what the scope is, and try to limit the scope of 3D printing initially so that the entire hospital is not exposed to it. And the reason I say that is because if you don't have the bandwidth to supply to actually serve your customers, because you have such a high demand, you'll have many more dissatisfied customers, and people will lose interest. And subsequently define what a success will look like in the first phase of the project. Engage department leadership and engage them early, engage them often. So for us, because we already had 3D imaging lab and we had expertise in 3D segmentation, radiology was the perfect place to put this in. It may be different from different places. Selling the vision to the radiology department is much better if you already engaged those from outside of radiology. So engage leadership from the stakeholder departments, like I mentioned, cardiac services to orthopedics to neurosurgery, interventional radiology, and oral maxillofacial surgeries, etc. Several questions you may want to ask is, do you currently use specific models? When we ask these questions, some of our departments sending out these things for print, if we were to do that in-house, we would have to reduce the cost by 10th. So that they were paying several $1,000s, and we can do that for 1/10 of the cost. What do your physicians want to do with the models? There are many things that people have already described, and try to assess what the anticipated demand is going to be so you can plan better. Resources required. I've sort of broken it down into capital and fixed costs, from 3D printer hardware acquisition to, sorry about that, to workstation level computers and software segmentation, acquisition for software for segmentation, as well as technical staffing and training costs. Operations. One of the things that we discovered is the consumables are probably the most expensive as an ongoing cost. So be careful which printer you buy and factor consumables into it. because that can potentially be a large cost. Level and source of funding is always the first thing that will come up, and you'll have to work through it depending on your innovation milieu. So what will small amount of funding get you? Well, you'll get you a limited number of printer choices, but good printer choices, and limited number of material types as well as colors. Staffing will be volunteer or per diem. A little more funding will get you more advanced printers, more color choices, and more training. $200,000 to $300,000 US dollars will get you a fully staffed and trained 3D printing lab with advanced technologies and allow acquisition of multiple printing technologies. So the funding sources that we entertain were hospital innovation grants, donor grants, some foundation grants, a traditional capital budget process, as well as combination of all those resources. So ultimately we settled on 2 grants: hospital innovation grant and donor grant, because we were successful at it. Not necessarily because it worked in that way, but we applied for many grants, and those are the 2 that we were successful at. Sustainability, this is the part of the program that can make or break your program, because once you have the printer, you have to be able to sustain it, and you have to be able to sustain the operations of it. So various models that we entertained for the first couple of years, because we have a grant, we're doing it for free for everyone, and we can cover the operations costs, labor as well as materials costs pretty easily. But eventually you had to develop how are you going to charge these departments for the services you're providing. So we have actually developed a way to have a small, medium, and large size models, and depending on the printer, we charge them appropriately, just to cover our labor and materials costs. One of the things we do is, because our health system is so large, and we have one central facility, we make sure that our customers know that we are delivering what we promised. So with every print that we give to people, either in-house within the same hospital or at our other platforms, we give them this worksheet that shows them that this is what we promised, this is what we got, what we delivered for you. So that was for print number 85. So several pitfalls. One can perhaps think that 3D printing can be easy. It's not always easy. Just buying a printer and downloading software does not do it. You have to develop expertise, and you have to collaborate with your partners. And I got to say, Materialise has been that partner that has really set us on our way. Starting the process by selecting a printer is another pitfall. You probably should know what you want to do with it before you select the product, the printer. And not having dedicated and knowledgeable people to run the lab. So we were fortunate that we had a volunteer, our team leader for 3D imaging lab, who volunteered and led the project. But it's critical that you have somebody who leads the project. And this, I can't overemphasize the importance of this, expert guidance. So attending 3D printing trade shows, conferences, and education seminars is absolutely critical. Visiting facilities that have already successful hospital-based 3D printing programs, perhaps like Mayo, which they've done an outstanding job. And consulting hardware and software vendors is another critical thing. They may have different opinions, but your job is to collect all the information and draw conclusions from that. So in summary, we've talked about the vision, engagement of leadership, how to sustain it, talk about pitfalls, and seeking expert guidance. I'd like to acknowledge nothing of this would be possible without my 3D lab team. Here's the team. Any questions? I think we'll take questions afterwards. Thank you.